The Colorado Organization for Latina Opportunity and Reproductive Rights, known as COLOR,
Yes, have you heard about COLOR before?
has been one of the groups at the forefront of connecting women with a focus on Latinas to culturally responsive reproductive care here in Colorado.
We have become very aware that there's a lot of people traveling to Colorado for care.
Aurea Bolaños Perea leads communications for COLOR.
When people come with us with their stories, seeking care, asking questions, asking who to trust, if they're from another community, they come to us to ask those questions.
Over the last year, they've gotten more calls for help. Higher demand meant ensuring clinics had the right resources.
For example, when the Dobbs decision happened, we saw that a lot of clinics didn't have translators on call all the time, every day. Now we know that a lot of clinics here in Colorado have ensured that they have a language hotline or somebody on call that can offer those services.
But as a new battle ensues over access to Mifepristone, Perea says they're looking at the impacts.
That is going to be a huge impact to communities of color, to young people that want to be able to make those decisions for themselves.
A study last year out of UCLA found that 46% of Latinas aged 18 to 44, what they consider childbearing age, live in abortion-restrictive states. Perea says their next steps stem from education.
Turning to us for questions when they really need somebody that understands their lived experiences and can level with them in a conversation.
So more than half of the abortions in the U.S. are done using the medication Mifepristone, according to several research and policy centers. There are other ways to have an abortion, like surgery or a different medication regimen. Abortion advocacy groups like COLOR say that they try to make sure people looking for care in Colorado understand their options, especially when it comes to different providers when making their decisions, Jenny.
Yeah, so much happening at the federal level, Luis. It'll be really interesting to see how it affects states like Colorado, where abortion is legal, other states where it might not be.
We have several organizations that will be looking into that, so yeah.
Yeah, all right, thank you, Luis.